My name is Ana Sort, and I am a nurse, an entrepreneur, and a gamer. And I am here to make health fun. And to do this, I've been spending the last 7 years of my life researching about video games and designing gamification platforms for healthcare. And to put a little bit of context on how does a nurse end up doing video games and games, I would like to give you a little bit of context. So I don't know how many of you know about this game. Anyone? OK. So this is Overwatch, and it was actually played by 40 million people around the world. And I am a big fan of Blizzard Entertainment, which is the company that created this video game, which I had also played. And imagine the thrill that I had when I had the opportunity to join Blizzard Entertainment as their company nurse back in France. So yes, you heard that right. So I was at Blizzard Entertainment as their company nurse. And as I arrived, I was fangirling all over the place, because, I mean, these were the people that were creating these amazing games that I was playing. So that was really fun and games, until one day, when I had one of the employees had a pulmonary embolia, between other things, due to an undiagnosed diabetes. Now, he was sent to the hospital, he was very ill, but he made it, and when he came back to the office, it was up to me, his nurse, to teach him about diabetes and how to live with this long-life disease. So what did I do? Well, what I was taught at university. Sat him down, gave him the talk about diabetes, talked to him about questions that he might have, and then I gave him a leaflet and said, see you in 3 days, see how you're doing. So he came back 3 days after, and I can tell you that was one of the most frustrating experiences I had as a nurse. He didn't remember much of anything, about 10% of the total that we talked about. And it was really frustrating for me, because this was a disease that he had to carry for his life, and he had to start today to get better. So I was thinking, what happened here? What went wrong? So I knew that the guy was very smart, because he played World of Warcraft, which is this amazing game that's super complex when you're raiding and you have this super high-level character that you have to kill all these bosses and whatnot. So it was definitely not an intelligence problem. So what was the problem? So I started thinking, what if I made diabetes more like World of Warcraft? Would we have more people understanding what it is and how it works? So I quit Blizzard Entertainment. I did a master's degree in cognitive systems, and actually had the crazy idea to develop an add-on, which is something that you download in the game and shows up in your interface without actually interacting with the game. But because I played World of Warcraft, I knew that I could measure distances in the game. So I knew that I could count these as exercise and have the glucometer have an impact depending on the exercise you did in the game. And also, I knew that World of Warcraft had a ton of foods. So I knew that I could use those foods and have it have an impact also on that glucometer. And so I had this crazy idea, and I went on to Games for Health Congress and explained my idea. And I was lucky enough to get Professor Stephen Jacobs from Rochester Institute of Technology to actually help me and develop this add-on with his programmer students. And it was up until 2016 WoW Diabetes add-on that people could download, and their character in World of Warcraft would have diabetes. Yes. And so it got me even more excited. Like, what can I get people to do if we make it fun, right? So I got into studying video games, and this is the 3 lessons that I've learned. So lesson number 1, big scary word, stress. You've all experienced it in the last year. I'm pretty sure at least the US says 8 out of 9, and Spain is 9 out of 10 people that have experienced on the last year stress. So anyway, the big bad word, I always get my students to tell me about like 3 different words that they would associate stress with, and the one that appears the most is anxiety. So like any other coin, stress has 2 sides, right? So the other side is challenge, right? And so what separates stress from challenge, really? So stress is the sensation that you have when you're valuing an experience that you have to go through by what you're going to lose or what's going to be missing by the end. On the other hand, when you're feeling challenged, is because you're measuring this experience with how much you're going to grow from going through it, as well as what you're going to win and learn and from it to evolve, right? So it got me thinking, where do we always feel challenged, but we never feel stressed? Well, playing games and playing video games, if they are well designed. So that got me into finding a paper which is called the PENS model, the player experience need satisfaction, which just talks about 3 main psychological needs, which are autonomy, competence, and relatedness. So I want to talk to you about autonomy and competence and why is it so important for challenge. So if we take a game such as Candy Crush, yes, very popular game. So this is one of the best games designed in terms of competence and autonomy. How many of you have seen a grandpa or a grandma play this game? Okay, a lot of you. I think the oldest person that I've seen play this game, and I actually asked them, was 82 years old. And so why are they playing these games, but they are not able to use, I don't know, their bank accounts on the phone or whatever? It's because this game is really well designed. It keeps on, so the autonomy you have in the beginning is very little. You can do very little things, and you can only do one move or another. That's it. And as your competence progresses, a little more autonomy is given to you, so you can do other things. So you can start getting the chocolate and getting other little challenges that make it a little bit more complicated, but because you have the competence to do it. So this is why it's so important to balance competence and autonomy when we're designing in general, especially when we're designing games, and especially when we're designing healthcare. I don't know if you remember the employee that had diabetes. I created a horrible system for him because I talked to him for about 1 hour, which gave him very little competence, and then sent him for 3 days on his own, where he had to make 1,000 decisions about his diabetes, and he had absolutely no competence whatsoever to take them. So I gave him a broken system, and he left the system. So this is the lesson number 1. Turn stress into challenge and pay attention to when you're designing to balancing competence and autonomy. So let's lesson number 2. Another thing that we have a lot in healthcare is people being isolated or lonely, especially during a long treatment process, but it probably has happened to you as well. If you've ever been on a diet, for example, you maybe don't want to go out on Friday night with your friends because they're going to go to the restaurant and you're going to order the pizza that you don't really, should be having. So, but on the other hand, we know that body system works, and this has been researched all over with many other things. So basically, it probably would have happened to you as well. If you go on a diet with a friend, it's easier than going on your own. And if you're trying to quit smoking, it's easier going with a friend than going on your own. And it happens with addictions and many other things. So this is because of relatedness. Remember the PENS model that I told you that has competence, autonomy, and relatedness? Relatedness is the intrinsic need of love, the feeling that you can trust others and others can trust you. And it's very smart the way that they use it in video games. How many of you know this game? Okay, Farmville was the #1 rating on Facebook games for 2 years on a row. Now, how did they do this? So basically, people played Farmville because other people play Farmville. So if you had a friend who probably invited you to play Farmville, and he was like, oh, Anna, this silly game that I'm playing, and actually to go forth in the game, I need 8 other friends to join me in the game, but you don't need to play, just accept the invitation, and that's all that I need from you. And because you care, you accept that invitation. And then you start playing the game yourself, and then, it goes forward. You have to invite 8 people, so you kind of look for your friends who you can invite. And so people play Farmville because people play Farmville. And I think this is a very smart way of using relatedness. Another thing that happens in video games is that we have massive multiplayer online games, such as World of Warcraft here. And a very interesting thing is it's very easy to instantly relate where you are and who you can relate most with in a video game. So when you enter a video game, you're level 1, right? And then you can click on other people and see what level they are. If they are level 1, they are most likely to have the same objectives and the same quest that you have. So it's pretty easy to get together to do things. In the same way, if you're a level 1 mage and you see a level 60 mage somewhere, then you probably can ask them how it is to be a mage and what challenges you may have in the future, because they know, because they've been there for a while. And so I think we can use a lot of these tools when we're designing for health, especially online communities, because these online communities could benefit a lot from right away knowing when you enter one of these who you are and who you can relate to, especially for people that have long treatments, as I just said before, because you can have your support family around you, but sometimes you just want that other person who's been through the same thing that you have and who can help you in your journey. So the lesson number 2 is, let's use video games to help us recruit the right allies. And so we're moving to lesson number 3. This is the situations us nurses face a lot. So when we're in hospitals, we usually go door by door trying to get our patients to move around the hall a little bit, because we know when patients are in bed a lot, it's never good news. So we always encourage them to try to go around the hall. Now, sometimes you might have machines hooked up, they might be weak, they don't feel like it, so it's kind of a struggle. But at the same time, that's what we have to do. And this was the same case for a pediatric hospital in Michigan until this game came around. How many of you know this game? OK, it was a pretty big deal of a game. But basically, this is Pokemon Go. So in Pokemon Go, you have to capture Pokemons. And the funny thing is that to capture Pokemons, you have to physically get where the Pokemon is and then capture it. So as you can imagine, all of a sudden, the nurses would go into the rooms and would not find children there, because the children were all around, walking around. So this did 2 things. 1, the children were walking around because they wanted to, not because they were forced to. And 2, they were socializing more. Automatically, any other kid with a thing like this was obviously playing Pokemon Go. So you had something, some ground to relate with. And for the parents, it was the same. Being, in a process where your kid is sick alone, it's really hard, but it was very easy for them also to socialize and to come together through Pokemon Go with their children. So what happened to these kids? If you think about it, when you play video games, you play these amazing characters in this epic story. And this is sort of what happened to these kids. They weren't sick kids anymore. They were Pokemon masters. And they had a clear objective. Go get all the Pokemon that you can. And they had constant feedback about how great they were doing getting towards that objective that they were set. So this is because of lesson number 3. We gave them meaning and purpose to the efforts that they had to do. So it was an effort for them to go walking. But hey, we gave them purpose and meaning to that. So just wrapping up, this is the 3 lessons that I've learned from video games. So using the challenge mindset, recruiting the allies, and giving meaning to our efforts. And so much talking about video games, I'd like to ask you, how many of you actually play video games? And yes, Candy Crush and mobile gaming does count as well. Let's see. I'm sure there's more. Don't be shy. OK, good. So for those of you who don't, I encourage you to download a popular video game. OK, you can choose any. It can be Candy Crush, can be any other topping the charts, right? Because those are the ones that are well designed. And then I want you to play it. But as you play it, I want you to analyze it. Analyze how they keep you on the challenge mindset, how you do not feel stressed, because they are leveraging very well competence and autonomy. Look at how they do the relatedness, how they make you connect with people. And third, see how they are making you motivated to keep on, clicking or doing the exercise that they want you to do. And if you play enough, you might get to someday, you might be able to actually grab those tips and tricks that you learn by playing those video games and apply them in some real-life issues that you might have at the moment So I really encourage you to keep on playing or start playing. And that's all. Thank you.